Thank you very much, Caroline, and welcome everyone to this webinar on Sexual and Reproductive Health and Rights Policy Portal. It's a great opportunity for us to share this portal with all of you today. And we also thank the IBP network for partnering with us at this launching webinar. And we are looking forward to 1 hour of very good presentations and discussions on this topic. Next slide. So as you can see, we have a fairly full agenda today. We have very diverse panelists who have been involved in preparing the portal, who have used the portal, and to hear experiences from various parts of the world, and also some knowledge about policy and how it can really be applied, and the importance of this kind of work that we are engaging in. And I would really like to ask the panelists to keep to time because as you can see, we really do have a full agenda today. And the next slide. So before we begin, just some housekeeping points. This webinar is being recorded, and afterwards, for those maybe who have not attended, or if you'd like to share it with other colleagues, it will be available on the WHO HRP YouTube channel, and also at the IBP network platform on those sites. You can submit questions at any time. There's a Q&A chat or on the chat, and we will have the panelists respond to any questions at the end of the presentations. And also very important is that today we are fortunate to have translations both in French and in Spanish. And therefore, if you would like to listen either in French or in Spanish, you can click on the button, which is on translation, and select your language of choice. And the next slide. Maybe this is where I should have actually started with introducing myself. I'm James Kiari. I'm the unit head of contraception and fertility care in the Department of Sexual Reproductive Health and Research in WHO. And on the next slide, it's really my pleasure to introduce our first panelist today, who is Dr. Ian Askew. He's the director of our department. And I think he is very well placed, having worked at various areas from research to policy formulation to utilizing policy to implementation with this kind of policy work. And I welcome Ian to give us some opening remarks. Welcome, Ian.
Thank you very much indeed, James. And I'd like to add my welcome to the participants to this launch of the SRHR Policy Portal. Welcome, everybody. Just a few words of introduction. As I think everyone on this webinar is well aware, achieving universal health coverage, which is both a sustainable development goal, as we know, SDG 3.8, and one of WHO's 3 billion targets, requires that national health systems must have an enabling policy environment. But fundamental to such a supportive environment are two things, essentially: a comprehensive and integrated set of health laws, policies, strategies, and guidelines, as well as cross-cutting issues, including human rights to healthcare, financial protection, and quality of care. And secondly, a full understanding of these laws, policies, and strategies and guidelines by those responsible for managing the health systems and programs and providing the services, as well as those benefiting from the health services delivered through the health system. This policy portal and the database underlying it seeks to contribute to achievement of a supportive environment in two ways. First, by providing a comprehensive and integrated database of documents for laws, policies, strategies, and guidelines. And this database brings together these documents from 155 countries and will be expandable to include other countries as we move forwards. And secondly, it's accessible, the database is accessible through a user-friendly online mechanism for accessing these documents. Indeed, thousands of documents will be instantly available with a few clicks of your mouse or a few taps on your screen. The database and portal will also enable tracking of country progress in adapting WHO's recommendations in national health policies, strategies, and guidelines related to sexual and reproductive health and rights, thereby providing an important tool that can be used by national and international organizations to hold national health systems accountable to making progress towards the goal of universal health coverage. The database that you're going to be learning about today expands indeed on an existing policy database of maternal, newborn, child, and adolescent health policy documents by adding data on 6 SRHR technical issues: contraception, infertility, sexually transmitted infections, sexual health, cervical cancer, and violence against women. Also, there's a complementary database on policies which is available through WHO's website on laws, policies, strategies, and guidelines concerning abortion. Development of this portal was coordinated by 3 WHO departments: and the Information Management and Technology Department. The work was coordinated by an internal task force of technical and thematic expert staff from across the 3 departments, together with a number of consultants who brought for organizing and hosting this webinar. I'm sure you will find the webinar both useful and informative, and strongly encourage everyone to explore and use it in your work towards achieving universal health coverage. So with that, thank you again, and looking forward to the remainder of the webinar. Back to you, James.
Thank you very much, Ian, for those opening and introduction remarks for what we are to cover today. And our first panelist is Dr. Teresa Diaz. She's the unit head, epidemiology, monitoring, and evaluation in our sister department of maternal, newborn, child, and adolescent health and aging. And Teresa will talk to us about a background of the survey, and also talk about the maternal, child, and adolescent portal and how it links up with the SRHR.
Can you hear me?
Yes, we can hear you, Teresa. I am not sure why the slide is not moving. Caroline?
There it goes.
Yeah.
All right, so I'm going to be speaking on behalf of the Maternal, Newborn, Child, Adolescent Health and Aging Department about this joint policy survey, in which you will be seeing on the Sexual Reproductive Health Policy Portal. But this was a policy survey that was conducted in 2018 and 2019. Next slide. So I'm going to give you a little history. In the past, we in the Maternal, Newborn, Child, Adolescent Health and Aging Department were collecting policies in our areas of maternal, newborn, child, adolescent health. And we had 4 rounds that were conducted from 2009 to 10, 2011, 2012, 2013, 2014, and 2016. It was Excel based. It did not collect source documents. There were variable response rates from countries, and it did not include sexual and reproductive health. On the other hand, the sexual reproductive health colleagues were collecting information in different focus surveys and had a separate abortion database that Ian also previously mentioned. So we felt that the way forward was to learn from the abortion database of how they did the survey and collected the documents, and then to create one sexual reproductive maternal newborn child adolescent health policy survey with advice from an outside expert group. We created an online data collection tool that had skips and checks, and it was not Excel based. And we actually collected source documents for the first time. Next. So as you already are aware, the survey was completed by 155 countries. There is a full report available on the survey. If you look here, you could see from the 155 countries how many were from each of the different regions. We collected thousands of source documents, which were uploaded by countries that completed the survey. Then we cataloged the documents to create a searchable online repository that will be available through our data portal in the future, but it's all ready to go. And we use those documents to kind of validate the responses to the survey. And we have that already done, and we're in the process of probably revising some answers based on that validation. Next slide. So how has the data been used? I have to say, of all the databases the data that we have in the maternal newborn child adolescent health department, this is the #1 requested data. And I'm not going to go through all of this, but just to say that this data has been used extensively in different reports for profiles in the Countdown 2030 country profiles. And we will have a paper that explains the whole methodology of how we collected these data. Next slide. So here is the MNCH policy data portal. I'll put in the chat the link. But when you come to our portal and you go to the top, you will see a link that says policies, and you can click on there, and that's where you see a drop down on the indicators, the documents, and the policy country profiles. And we are in the process of improving the functionality to allow for keywords and topic search even better. Next slide. And when you go into any indicator in the policy survey, you can click on a specific policy or guideline or law, and a map will come up to tell you which countries have that. And then you can click on the map, and then you can see on the side how either you could click all the countries or a specific country and then see a visual on the side. That's either, mostly it will be bar charts with the policy survey, but it could be trend lines as well. Next. We've created, now these are combined sexual, reproductive, maternal, newborn, child, adolescent policy country profiles. So for each country, you can get an actual profile that comes up that tells you for each of the areas. It does population, because I'm cross-cutting sexual, reproductive, and maternal, newborn, and child, and adolescent, and you could see some key policies. And then you can actually download it as a PDF so that you have your own country profile. And the way it works is that if we ever when we update the policy survey, it automatically generates this country profile. Next. And this is the, in the future, already cataloged, but this is what it's going to look like. We have over 5,000 documents that were completed from different countries. And you'll be able to go and look for a theme or a topic or a language and be able to look at different policy documents themselves. So if you're in one country, you could say, well, how did another country develop that policy or that law, and then you'll be able to see the information online. Next. So how does this link to the portal that is going to be demonstrated today? So when you go to the front part of our data, our overall data portal, you'll see some tiles on the bottom in different areas, and you'll see one tile that says Sexual and Reproductive Health and Rights Policy Portal. And when you click on that, you'll be going over to the portal that is being launched today. Thank you very much.
Thank you so much, Teresa. Excellent presentation. And now we'll move on to Kushet Nosirov, who is a consultant with our department and has really done a lot of work to create a policy portal to just walk us through how it looks like and how it works. Our aim is just to make sure that you have a sense of what it is, so that we invite you to then take your time and go through the portal. So Kushet, over to you.
Thank you, James. So hi, everybody, and without further ado, please let me provide you with a short demo of the portal. So next, please, Carolyn. So there are different ways to access the portal, and one of the ways to achieve this is through Global Health Observatory page that is located on WHO public website. So if you scroll down below, you will find a link to Sexual and Reproductive Health and Rights Policy Portal. It will take you directly to the home page. I think video is playing. So it will take you directly to the portal homepage, where you can find the 6 thematic areas of the SRHR department presented as separate sections, and each of which containing 2 pages of overview and national policies page. Down below, you will find tile links that direct to the same thematic areas. And in addition to that, there is a link to maternal, newborn, child, and adolescent health and aging data portal. Let us now deep dive into one of these thematic areas, such as family planning and contraception. As you can see on the landing page of this topic, there is a relevant picture and relevant introductory topic text. And there are dedicated sections for related documents and links. You will also find a link to national policies page to see the list of indicators coming from the survey. As you can observe, the indicators are grouped according to the thematic area they belong to. And if you expand any of them, you are going to see the shortlisted indicators belonging to selected thematic area. You can also search an indicator by a keyword. And once you click on any indicator of your interest, the portal generates visualization reports. So it takes a little bit of time to get rendered on the web page. The one on the right reflects number of responses submitted by countries. It is a bar chart. And you can observe that 44 WHO member states that have not participated are marked as survey not completed here. And on the left side, there is a map of countries that are colored as per the response they have submitted for this particular indicator. The portal allows you to set filters by different criteria, such as WHO region, World Bank income group, or any country, and the visuals get updated automatically once a filter is selected. The Metadata tab lists a brief information about indicators, such as definition and method of estimation for this indicator. The portal allows you to download data that these visuals rely on, and the exported data will come in the Excel table format. The Questionnaires tab allows you to download the questionnaires in 7 languages. Data Requests tab will let you download and fill the data request and sharing agreement in order to request survey data of your interest. And the last tab, that is indicators by country, is very helpful if you are interested in responses submitted by a particular country. Once a country is selected, the portal will list all indicators colored according to the response this country has submitted for each of these indicators. And you can also narrow down this list by a specific thematic area. So basically, this was all to cover during this short demo session. Thanks for your attention, and over to you, James. Thank you.
Thank you so much, Kushet. And again, the idea is to just show you how the portal looks like and invite you to visit the site and look at the portal, and welcome also to use the data and to request for the data and use it to analyze and to understand what is going on. So I think policy is a beginning, but policies are as useful as they are implemented. So our next panelist, Professor Aisha George from the University of Western Cape School of Public Health in South Africa, will talk to us about policy and implementation. And welcome, Aisha.
Thank you. I'm just going to say hello on video and then keep the video off to improve the connection. It's an honor to be here with you at the launch of the WHO Policy Portal, which is a culmination of years of concerted effort led by WHO to improve the quality, coherence, and accessibility of policy tracking. It's light years away from the ICCM policy tracking I worked on with Teresa and others at WHO and UNICEF in 2008. So huge congratulations to Teresa and all those who were involved at headquarters, regional, and country level in making this a reality. Next slide. Given the limited time and the opportunity to hear from such a breadth of speakers, I will focus my inputs on these 2 points, drawing on health policy and systems research. What is policy, and does it matter for programs? What James mentioned, how is it linked to implementation? Next slide, please. While the focus of the WHO Policy Portal is on policy documents, it's important to contextualize this effort. Policy research focuses on understanding the different dimensions of policy, which include policy as a decision-making process involving negotiation, consensus building, but also compromise and contestation, all elements familiar to those working on sexual and reproductive health and rights. Policy is a set of decisions, at times detailed in policy documents that are found in this portal, but not always. Sometimes decisions are made informally and unofficially. And lastly, policy implementation, which, as shown by the cartoon, can be done in ways quite differently from its intention, or sometimes not implemented at all. All of these different elements of policy are key to understanding sexual and reproductive health and rights. And the policy portal is one step in a broader endeavor to support and understand what triggers and sustains social and political change that is key to advancing sexual and reproductive health and rights. Next slide. This understanding of policy aligns with WHO's own definition of what policy is, and the policy triangle, a well-known framework in health policy and systems research. Next. It signals the role of this policy database as one part of understanding policy content and how this combines with understanding the multiple factors that together drive policy change. Who are the actors involved or excluded? What's the context? And what are the processes involved? Next. A central element in all of this, in understanding policy and policy implementation, is power, particularly because we are talking about policy for marginalized groups, those who largely do not have a voice. This means women, stillbirths, and newborns whose deaths are still not fully counted during or after childbirth, women who must overcome discrimination and or intentionally curtailed by those who have power. Policy tracking and analysis is one step in challenging business as usual that continues to fail those most left behind. Next slide. So does all of this matter for programs? I'm sharing findings of an analysis of global financing facility country planning documents. We analyzed how adolescent health was prioritized in the national investment cases or plans, and then whether these priorities were followed through in World Bank funding agreement or PADs. While adolescent health was recognized as a priority and strategically addressed in some country documents, there is much room for improvement when looking beyond content to actually indicators and whether there's actual investment. And then moving from the plan to actually the funding agreements, what happens? So we looked at, from the documents that were available at the time, we looked at the few initial countries that were going through this process. Next, so while some countries had adolescent health as a priority, for instance, Liberia and Tanzania with support from HRP, next, this was not necessarily followed through in the funding plans. The key problem in implementation, the implementation gap. Next, in other instances, while not in the national plan, attention to adolescent health was in the funding plan. And last prompt, can you go to the next click? And in a final set of countries, it was neither in the national plan or in the funding agreement. Fundamental to this analysis is access to documents and the importance of the WHO Policy Portal in creating a repository of documents cannot be underestimated in creating a starting point for further analysis. And indeed, as we take this analysis by Countdown 2030 further with the GFF, accessing the right documents is a real challenge and requires quite a lot of effort. And the policy portal in this instance is a huge gain. So it's critical because we need to go beyond what people think or say is in the policy, go beyond the policy, the rhetoric that sometimes is applauded or promoted on these issues, to actually what's in the policy and how that translates into programs with funding so that it can make a difference. It's a key step in ensuring accountability for advancing sexual and reproductive health for those most left behind. Thank you.
Thank you so much, Aisha, for that very nice presentation, and particularly showing how it is very important for these documents to be made available for people to look at them and to be able to understand what the policies actually are. In working on the policy portal, as WHO, we worked very closely between the headquarters, the regions, all the WHO regions and the country offices. And to give us some regional perspectives is Anoma Jayatilaka, who is a medical officer in the Southeast Asia regional office, working in the maternal, child and adolescent unit, and was very engaged in collecting data in the portal and also in disseminating the findings in that in the region. So Anoma, over to you.
Thank you, James. And then good morning, good afternoon, and good evening to everyone. Next slide, please. So I'll just talk about the regional perspective of RMNCAH policy survey, how we use this. Next slide, please. So next. Another one entry. Yeah. Yeah, in the all countries in our region has engaged in this survey, that all 11 countries, 100% the WCOs and ministries of health engaged in this survey. So then what we did at the beginning. So after we simply analyzed this in the very simple way in the Excel sheet, and then we categorized the policies. Green mean policies are available. Policies red mean that no policy. And then that's the first exercise we did. Then after that, we disseminated it. And then also after that, we mapped these, matched these with the DHS and the mixed data, and then to see whether policy and coverage is matching or not. So then we categorized our countries into 3 ways that how we are going to help them. Then first category is left-hand corner is countries with policy and good coverage and good health system. For those programs, we have to look about the equity and quality focus. Then the middle one is countries with no policy, low coverage and medium health services. So then we have to advocate for them for policy, and then we have to work with them for having policies as well as the implementation. Then third category is the right-hand corner, countries with policy. Policies are very favorable, but coverage is very poor, and the medium poor health system. So we look at then what the implementation issues, like we look at the service delivery platforms, why this policy is not working in these countries. Next slide, please. Next. Okay. So then 3 times. And then survey we have mapped at the beginning that it's a very simple Excel sheet. It's very useful, then green and red. And then we identified and then we shared with. Then after that, what we have done, and we mapped with all the DHS and mixed data. Then we have developed the right-hand corner, next slide, some fact sheets for the countries. Then they understand that about what are their impact indicators, and then what are their policy issues, and then what are their coverage. And then, so this was really disseminated with countries, and then we really triangulated with other data sources. And this we used in the different level of decision making. Next slide. Next. So then how we use this? In our region, we are having the technical advisory group on women's and children health. So then we have developed series of background documents, and then analyzing this policy and mapping with coverage and other health system areas. And then we make a lot of recommendations for the member states and the regional director. And then other thing is, we look at the technical programs like the maternal death surveillance program, antenatal care, postnatal care. What are the areas you need refinement in the policies? So then we analyzed all these things into the different programs. And then, as I mentioned earlier, if favorable policy but coverage is low, then we have commissioned now in-depth reviews of why this is happening specifically in the service delivery model. And then we recently developed our regional strategic framework for up to the 2025. And then we use these findings very much to be making strategic guidance. Next slide, please. So this is one example I want to show you that. If you look at in our 11 countries on the postnatal care for mothers and babies, you can see that all green. That means policy is very, very favorable. Only one red box. Next. So if you look at the coverage, you can see only 2 countries you are having the very good coverage for postnatal care for mothers and babies. Next. Next. So then this is a clear gap between policy and implementation of postnatal care service in CR countries. So that's why we thought that we have to commission assessment of service delivery platforms in PNC to understand the reason for low coverage with favorable policies. So this is now undergoing. We are analyzing ANC program, postnatal care program, and other family planning and child health program in the specifically the service delivery platforms, why this coverage is not there. Then next slide, please. Next slide. Yeah. So in as I mentioned earlier, that under each program, this is a newborn and child health program, and then maternal death surveillance and response, and then stillbirth reviews notification. We all programs map like that. So then program managers in different areas of RMNCAH, they look at it. Where is the policy is there, but where is the policy is not there? They are advocating for policy. Where there is a policy is there in the cover, it's not happening. Then you looking at the design of the program. So these are the some usage of RMNCAH policy survey in the CRO region. Thank you very much.
Thank you very much, Anma, and particularly for highlighting how these policies have this survey and its findings have been used in your region. And I must emphasize that similar work has happened actually in all the regions, but we just wanted to highlight some of the work that has gone on in the Southeast Asia region as an example. And change and the impact of any work is only felt when it actually reaches the people in the country. And therefore, we would like to hear on country perspectives from Olumuyiwa Ojo, who is a technical officer working on family and reproductive health in the WHO country office in Nigeria. So Ojo, over to you.
Many thanks, Dr. James, and thank you for inviting us to this launch. So because of the time, I'll be talking briefly about our experience using the portal and also talking about what is our expectation as somebody working in the country. Because of internet bandwidth here, you allow me to please shut down my video. So as countries engaging in more peer-to-peer learning, we've seen this portal as having so much potentials for Nigeria and so many other countries, especially in the southern parts of the world. So I'm going to use 2 examples of our work, 2 WHO initiatives to demonstrate how we've seen this portal which has worked. The first one is the WHO-led QED network. You heard from Teresa the previous work that was done through the MCA department on this. This portal is part of the bigger portal that WHO has developed for this. And what this has done is for a country like Nigeria, in this network, we can go to other countries and look at what they are doing at different levels. We can have access to their policy, their guidelines. This network is generally a learning platform. And this portal, it's a very good opportunity for the countries to learn from each other. There's a community of practice, the opportunity to access country data, the ones that are freely available, and to learn how countries, even without interacting with anybody in the country, And that's very important, especially with COVID, with restriction of movement. The typical traditional study tour that we usually have has become almost impossible right now. But this portal has become a tool for us to learn from other countries. I'll go to the second example and demonstrate the struggle that we've had and how the potentials of the SRHR Policy Portal. So this is about a project that we are implementing in Nigeria, the FP Accelerator project. And this is being implemented in about 14 countries in different areas of the world. Nigeria is one of the beneficiaries of this project. So one of our aims was to improve quality of care in family planning. We want to mainstream that within the existing quality of care for maternal and newborn that we already have. So we decided to learn from Uganda, another country in sub-Saharan Africa, who have some experience on mainstreaming quality of care in family planning. And it was interesting to us too. We listed our aims and all that. Next slide. And we had the WHO guideline to guide us through the process. But we were stuck on step 2. In step 2, we were supposed to do like a landscape or desk review analysis. This was during COVID-19. We did reach out to colleagues and things like that. We found that it was practically impossible, especially for an implementation level document, to have access to policies, guidelines from another country without first making contact with that country. And that's one of the things we think this portal can really solve for us. Next slide. So this is talking about some of the challenges we faced trying to reach out to our colleague. We found that it was very difficult because most of these policy documents, reports, and guidelines that were developed in the country, they are more, I can categorize them as gray literature. They don't find their way sometimes to the internet. So it's difficult without having a foothold in the country to get that. We had paucity of published policy documents, guidelines, like I said, and we had to, add that inertia where we couldn't really do so much until we had to reach out to colleagues. And that for us was very instructive. This portal, I've gone through it, we've started using it. If and when all the countries fully embrace it, upload as much as possible of their policy documents there, share freely, we can actually learn from not just Uganda, we can learn from different countries that have the same socio-demographic, socio-economic characteristics as Nigeria. So we see that this has so much potentials, and we look forward to it. Next slide, my last slide. Just talk about some of these, some of the expectations, some of the things we think we need to do further. I must commend the team that put up this gigantic database or portal, but there's still a lot that we as countries still expect to be done. There still needs to be a lot around dissemination, starting from this meeting and also to country level, to stakeholders, the academia, the policymakers. We think this resource can be a warehouse of all the policy that can even live beyond our generation. We also need to monitor the user-friendliness of this database. Is it satisfying the needs of the users? It should also have a robust search functions. Right now, which is, I think, was deliberate. You can go from one country, from one indicator, but to just search, to develop a search term and search generally, it might be difficult for you to do that. Also, we need to also develop mobile apps if you can carry this big portal. that would be great to have that. And also countries engaging on peer-to-peer learning exchange. I think I really want to recommend this portal to them. It will be a great resource for them. And also we did talk about, for us, how do we take policy to the last mile in implementation, and also reporting how these policy interventions have fared or have helped our situation. So we think we should also have reports, some also scientific publications that deals with different policy areas per country, so we can curate such high quality scientific publications and also make it to be part of this portal. And also great literature, like I said, guidelines, reports that were developed and approved by each country needs to also be part of this. And there needs to be some ownership, which I know was part of the methodology, knowing that it was government officials that submitted most of these reports and policies and on like that. Thank you so much for inviting us.
Thank you so much, Ojo, for your presentation, and particularly for highlighting very specific use cases for the portal. And I think that is very important, and also highlighting the issue of ownership, which is very key if we are to be successful in using this policy portal and making sure that it does make changes in the way programs are implemented. So our last panelist is Manuel Howitz. She's the Director of Programs at International Planned Parenthood Federation. And non-governmental organizations, I think, were the very first organizations that really interacted with us wanting more information for the policy portal. And I think non-governmental organizations are really at the center of implementation of programs and have a lot of opportunity to use this policy portal. And therefore, I'll hand over to Manuel to tell us more about some non-government organization perspectives. Over to you, Manuel.
Thank you very much, James, and thank you very much to the WHO team and IBP for organizing this very important webinar for launching this portal. I will also put my camera off to help with connectivity. So next slide. So first, I really want to congratulate WHO on launching this comprehensive and much needed resource, this portal that brings together data, national policy analysis, strategies, laws, guidelines, report that are so relevant to many of the areas that NGOs like IPPF work on. IPPF works through a very large network of about 130 member associations across the world. And so having this type of one-stop shop resource that clearly identifies specific reference to the key sexual and reproductive health and rights and GBV issues, which they really address in their daily work, in national laws, in policies, enable those local member associations to ensure the provision of services safely. IPPF member association work both in advocacy and service provision. So on the service delivery side, we are, for instance, very pleased that the setup of this portal mirrors that of the WHO Global Abortion Policies Database, which Ian also referred to. And that's an extremely useful resource already for many of our member associations. Having national policies easily accessible enables member associations to develop and provide safe abortion care, for instance, knowing the gestational age limits or health exceptions, while also identifying opportunities for advocacy to liberalize policies and laws. Next slide. On the advocacy side, we believe this portal will be useful to develop messages on sexual and reproductive rights backed up by relevant evidence. For example, the data on comprehensive sexuality education as part of the mandatory in-school and out-of-school curriculum for adolescents can be used effectively in our messaging to ensure that young people in all their diversity can rightfully access comprehensive sexuality education. This portal importantly allows organizations like IPPF and member associations to monitor implementation of policies and keep governments accountable to their own laws and commitments. Another great advantage we identify is the ability to make comparisons between existing policies across different sexual and reproductive health issues, and to leverage on favorable existing policies to advocate for greater access. As an example, in countries where there is a specific policy on task shifting for contraception, or policies allowing categories of cadres other than doctors to independently provide specific contraceptives such as injectable, implants, and IUDs, member associations can not only implement and disseminate this policy, but they can also work to ensure that these task-shifting guidelines are applied to other services, for instance, as an entry point for task shifting in safe abortion care. Our regional officers can champion the regional rollout of guidelines, and platforms especially so when they are engaged partners in their development. And as an example of that is the regional rollout efforts of the WHO digital adaptation kits, where with WHO, and it was really great to see Anoma here, and the Asia eHealth Information Network, the East, Southeast, and Pacific Regional Office of IPPF are hosting a regional webinar in August this year. This event is a follow-up to a 2020 regional webinar to disseminate WHO digital health guidelines in the Asia and the Pacific. And just to show how these events can allow greater dissemination of the guidelines, and one of the speakers earlier mentioned the importance of dissemination, we look forward to collaborating on the dissemination of this resource. Within IPPF, we will share it with member associations to continue providing rights and evidence-based care that are relevant to people's needs, but as well advocating to expand access to sexual and reproductive health and rights. So thank you very much, James, and thank you very much for allowing me to take part.
Thank you very much, Manuel. And we've had, I think, from very diverse panelists, both from global perspectives to national perspective, regional perspectives. And I see on the Q&A and also in the chat, there have been a lot of questions that have been posted. And I have also noted that there's been very lively discussion. And some of the panelists have also responded to the questions on the chat. And we encourage the panelists to also respond on the chat. We have just about 5 minutes remaining. I'm sure the panelists have been able to look and see the questions. So I will just give the panelists 1 minute each to respond to an aspect that they feel is very important. We don't have to respond to all the questions because I see already there's been the responses done in the chat. And so strictly 1 minute, and we'll start with Teresa.
Hi, can you hear me?
Yes, we can hear you.
So 2 things. To assess implementation is very difficult. You're not going to have a database like that, but you need to make a comparison between the policies and the coverage and the outcomes. And Anoma gave a good example of how to do that. And just to tell people that we will be updating the policy survey in 2022 and 2023. We're just planning together with the different departments on how to do this and regions and how to do this.
Okay, thanks, Teresa. And Kushet, any reflection?
No, I guess thanks. We have resolved some through private communication.
Okay, thank you so much. And I think it's very important as we finish to emphasize that as for all participants, please do visit the site and go through the portal and see what policies are there. And Aisha?
I think this is such an important starting point. Even if implementation is challenging to measure, what is the baseline? And I think the starting point in ensuring that people's key services, key health systems components, and people's rights are recognized are in the policy. That's the starting point. So this is a great, it's fantastic that this database is now available. And now we need to use it. And I'm glad that people are, but we need to get the analysis out for it to actually affect change. Thank you.
Thank you so much, Aisha. And Anoma?
Yeah, I think this is a very useful for the regions and countries and also for the globally. I feel like that it's current that we are going to planning to update it. If you when you're updating it live, if you can do it live way, it's very useful for the ministries. And then also dissemination also need to be more focused, as well as how to use this is in the programming, and then specifically for program planning and management, I think it's the area that we have to work together. Thank you.
Thanks, Anoma. Ojo?
I think I'll just reiterate the need for targeted dissemination of this wonderful, wonderful piece of work. I think we need to do more around that. There's so much. It's still not complete. Like people have said, there's still need for updates, countries to submit some of these policies. But the way to start is to show countries what they have, and when they see they don't have some documents available there, they will be interested in being part of it. And we need to work with professional associations and other stakeholders to disseminate and make sure this is being used. It's a lot of investment already. Thank you.
Thank you so much, Ojo. And Manuel?
Well, to, I think, repeat what I think it may have been Aisha mentioned earlier, information is power. So for civil society organization, having direct and easy access to such a large database of information that allows them to program their services, their advocacy based on evidence, and is absolutely critical. So we really congratulate again WHO for this initiative, and we are very happy to continue our collaboration through IBP and directly with the WHO for the dissemination at the local level with our member associations.
Thank you so much, Manuel, and I would like to thank all the panelists. I think everybody agrees that we've had excellent presentations and very good interaction through the Q&A and on the chat. And we invite everyone to visit the SRHR Policy Portal and see what is contained therein. And also, I would like to thank IBP and particularly Caroline and Ados for supporting this work. And also, sometimes we forget to thank our translators who have done excellent job for our participants that were listening in French and also in Spanish. And I wish everyone to have a good afternoon, good evening, or good morning, depending on where you are. And bye-bye.